Good afternoon, everyone. My name is Greg Shaw. I'm the Director of International and Corporate Relations at the International Federation on Ageing, based here in Toronto, Canada. I'll be moderating the discussion today. So on behalf of the IFA, welcome to the 5th webinar of the Post-Global Conference Education Series. For those who don't know anything about the IFA, we're a non-government organisation. We have general consultative status at the United Nations and its agencies, and in formal working relations with World Health Organizations. Headquartered in Toronto and is a global point of connection for experts and expertise to influence and shape policies that impact the lives of older people. So the education series is prepared in a lead up to the 15th Global Conference and post the IFA 14th Global Conference. We've been holding webinar series discussing emerging sub-themes within the framework of the IFA conference themes, addressing inequalities, age-friendly environments, combating ageism, and towards healthy ageing. This webinar is conducted under the theme of enabling functional ability, which provides the opportunity to showcase impactful and sustainable work promoting the health and well-being of ageing populations. This webinar aims to capitalise on the momentum of Canada's Vision Health Month, which was May, and its associated audience to improve awareness to provide important updates related to ageing and vision health. In Canada, May was Vision Health Month, marked an important opportunity to raise awareness of the social and economic impact of vision impairment and loss, and the urgent attention required to influence policy and practice at a country and international level. The IFA organised a plenary discussion on May 28th with experts in the field of diabetes, ophthalmology, geriatrics and vision health education, which led to stimulating discussions around dispelling myths surrounding vision health of older people. Now's the time when organisations advocating to improve access and screening for safe and effective treatments for eye conditions work together with a common agenda. Today we have two well-renowned speakers presenting this webinar. Ms. Louise Gillis, the Canadian Council for the Blind, nursing diploma, Aberdeen Hospital and nursing, followed by several nursing management and communication courses over several years prior to a Bachelor of Science in Nursing in 1996. In 1997, she became involved with CNIB, sudden vision loss, and served as on the advisory board of Sydney District for many years. Further volunteering has been in 1998 when Louise became a member of CCB Sydney chapter of the Canadian Council of the Blind. She has served on the CCB at all levels, including committees advocating for accessibility for blind vision impaired Canadians. In 2010, she was elected to the position of National President and re-elected in 2014 and 17. So she comes to us with a lot of experience in the field. Mr. Thomas Simpson from the Canadian National Institute of the Blind will be presenting the second presentation. He is an experienced leader in government relations and advocacy, stakeholder engagement, event planning and coordination and operations, who is constantly seeking experiences to improve the lives of Canadians. He is the current head of public affairs for the National Institute for the Blind. So presentation one will be by Louise, and she'll provide a national perspective of vision health and discuss the role of CCB's role in vision health key priority areas. The second presentation, again, will be some national perspectives from Thomas in terms of the Canadian perspective, and he'll talk a little bit about CNIB's roles in vision health in Canada. So welcome to both Louise and Thomas, and I now hand over to Louise, so thank you. Just before I do that, just for participants, you'll notice that there is a chat function on the bottom of the screen, and people can pose questions throughout the course of the meeting. I will be summarising those and then directing those as the moderator to the two speakers towards the end of the presentation. So please feel free to use that function as much as possible. I will also let people know that this particular recording is recorded and will be available on the IFA website in the days to come. So Louise, thank you, and I hand over to you.
Thank you, Greg. It's an honor to be on here, and today I'm going to speak to you in regards to healthy vision and ageism globally and what part CCB plays in that. As you see, the Canadian Council of the Blind is the largest membership-based organization in Canada. Our mission is to work together as a community of peers that acts to improve the individual and community quality of life of people who are blind, deafblind, or living with low vision. The Global Coalition on Aging in December 2018 held a life course on vision, healthy vision. This was a roundtable which resulted in a report working towards solutions to ensure aging is a path to health, productivity, and economic growth. As the CCB National President, I attended this roundtable along with about 23 others to provide input to the report that followed. And this report is part of what I will be speaking in connection with today. Severe vision impairment and vision loss are widespread, largely avoidable, and posed to skyrocket if we fail to motivate action on eye health for older adults. As we are well aware, severe vision impairment is already widespread and expected to skyrocket as our aging population grows. It is expected that the numbers of the population in Europe, Asia, North America, and Australia will triple by 2050. In a recent survey conducted by CCB Vision Loss, was the biggest fear among Canadians over hearing and other senses. This was also noted in the USA study. As a person living with a significant impairment, living the experience on a daily basis, I fully understand the impact on my independence, health, and quality of life, as do all our board of directors. The acute fear has not made a significant impact on an increase in health care dollars, which means the health care dollars have certainly not increased in any way to help prevent vision loss. A pervasive view continues to persist. The vision loss is simply an inevitable consequence of living longer and does not warrant attention, action, or investment. Therefore, this leads to many individuals not asking nor receiving regular eye exams, hence resulting in poor or no treatment in many countries. A full 80% of vision impairment and vision loss is considered avoidable. World Health Organization, blindness and vision impairment. AMD, as we know, is a serious disease which is treatable with early diagnosis and continuous care, and therefore is a major contributor to the global burden of avoidable vision loss. Many patients who have received treatment may not be able to continue due to the high cost and self or family for transportation to clinics, time off work for caregivers, and accommodations due to living a long distance from treatment centers. Glaucoma is one of the leading causes of blindness. Those most at risk of developing glaucoma are also the least likely to continue treatment, leading additional complexity and urgency to the end for solutions. It is evident that lack of early investment in eye health leads to higher costs later for health systems, elder care systems, and for society. It is now that we need to take action to make vision loss a high priority on the public health and economic policy agendas. The CCB has been promoting eye health care through our mobile eye clinic, MEC for short, public education such as sessions in schools, community groups, and various displays. Vision and fall prevention go hand in hand. Through the collaboration of the Canadian Council of the Blind, mobile eye clinics, and supported, Ottawa Public Health and Ottawa Community Support Coalitions and Ottawa Community Housing, seniors receive the necessary eye care that will help to prevent future falls and support healthy aging. The mobile eye clinic contributes to improve older adults' health and access to services while increasing knowledge about good vision and eye health as a key way to prevent falls. The cost of vision loss will continue to increase drastically if we do not change the way it is currently dealt with by healthcare dollars. We must factor in rehabilitation dollars, the cost due to falls, and long-term care. Mobile eye clinics, such as MEC, are not currently under healthcare expenditures, but through charitable dollars. With this type of clinic, aging population, in long-term care facilities can receive early intervention that would otherwise be missed and therefore could add to costs because of not being diagnosed and result in falls or missed diagnosis of other health conditions. Compounding negative costs, both financial and in terms of quality of life, like vision loss itself, are largely avoidable, but several key barriers have made it difficult to motivate action on eye health. When we talk about the burden of on caregivers, it's often the time away from work, lost wages, or inability to cope due to raising a young family. What needs to be considered is caregivers are often unaware that eye disease is not always a part of ageism, and that frequent eye exams can diagnose AMD or glaucoma at early onset. This is where CCB does provide education. One of the major campaigns is I See You, in conjunction with the International Federation on Aging, IFA. CCB has had some major media campaigns during White Cane Week in February, encouraging eye exams and healthy living in prevention of illness. May is Vision Health Month, as we mentioned earlier, in Canada, a time when organizations, often for the blind, stress the need to educate and promote vision health. Some barriers that are out there are attitude, structure, treatment burden, strain capacity, and policies. Attitude is one. It should not be characterized as a normal process of aging, but does present as one of the biggest risks. Often in care facilities, symptoms are frequently dismissed by providing who perceive them to be an expected outcome of aging. Vision loss can add to other conditions, and if you have vision loss, quite often dementia is one of the other diseases that may be affected because we can't see right, and people with dementia already have a difficult time processing. So that is a major thing, and quite often caregivers in care homes don't see this or don't realize it, and therefore the patient does not get the treatment needed. The structure for our health system is another barrier. Eye care in many countries is segregated from the rest of the system in what we call silos. These so-called silos fail to meet older adults where they are, even those in frequent contact with healthcare systems, as they may manage chronic conditions that may be comorbid with deteriorating vision, such as diabetes. Those with vision impairment are more likely to suffer from approximately 13 other conditions, including hearing impairment, which is 1.9 times more likely, kidney failure, 2.3 times more likely, and stroke, 2 times more likely. This segregation is how our systems are organized, creates missed opportunities for earlier diagnosis and a more comprehensive, coordinated, and person-centered approach to health and well-being. Through our work at CCB, we speak with the health departments across Canada, both at the provincial level and also at the federal level, to promote measures for the conservation of sight and the prevention of blindness for all. Canadian Council of the Blind carries out action research designed to improve the quality of life of persons living with vision loss and to create awareness of vision. CCB has the mobile clinic directed towards children, youth, and seniors. The results of the clinic demonstrate a significant need for eye care awareness, eye examinations, and overall vision health. Further, the MEC can serve as an integrated platform to offer additional health services and that can achieve a more economically deliverable model for overall care and prevention. Further, the MEC can serve as an integrated platform to offer additional health services that can achieve a more economically delivered model for overall care and prevention. The CCB has made representation to the Canadian Association of Optometrists, CAO, the Ontario Association of Optometrists, OAO, regarding possible participation in MEC. And to date, they have not been, there's been very little advance in this. The Government of Canada and Ontario have yet to establish a national and provincial vision loss prevention strategy. In contrast, for example, the Government of China, which has done so, and in relation to the same, based on CCB model. In May 2015, CCB and Alliance District 4A participated in MEC in Hebei province. China is, and in conjunction with Hebei Eye Institute and the Hebei Charitable Foundation. Also way back in 1967, CCB provided funding for a mobile eye van to India with finances for 1 year. Another barrier is treatment burdens, as in most areas, the treatment for AMD, DME, and CRVO is limited to ophthalmologists, creating a bottleneck to treatment. With long time waits for treatment, sometimes up to 12 hours in one day, not including the transportation back and forth. Many patients drop off and after 1 to 2 years, and therefore slip backwards in disease process. This also leads to strained capacity. The relative low number of specialists to provide this special care points to an opportunity to empower providers across the eye care ecosystem. Policies can create additional barriers, the manner in which eye care is financed. The challenges that to meaningful action on eye health are surmountable, but overcoming them will require coordinated and sustained efforts across sectors and stakeholders. We have an opportunity for action. As the World Health Organization prepares to release its first World Report on Vision in 2019 and to launch the Decade of Healthy Aging in 2020, member states and their policymakers, the eye health and aging communities, and the private sector all have the opportunity to come together today and begin to interrupt the status quo on vision loss in older adults through targeted and coordinated action along 5 pillars. The 5 pillars are access and capacity, financing, research, education, and workplace. Access and capacity greater health literacy, update training and standards, update clinical practice, improve communication and care, ensure a holistic approach to maximize efficiencies, and build eye care centers. MECAS, as described by CCB, can be a form of action. Financing. Introduce reimbursement to motivate prevention and earlier diagnosis and treatment. Introduce interception to encourage a personal-centered approach to care that considers the health of the whole individual. Support policies that increase access to the right treatment at the right time and include preventive eye exams in the coverage. Research. Invest in research into innovative treatments, invest into strategies to improve treatment adherence, improve and advance community-level public health intervention for eye health. CCB works with Fighting Blindness Canada in research of this type. Education. Launch a coordinated and sustainable education campaign, increase literacy on importance of eye exams, and educate health professionals re the connection between eye health and other health conditions. Many Canadians are still not as aware of the signs and risks factors for vision loss. Eye health, vision care, and post-vision loss rehabilitation and therapy should be a core component of overall health care, and the public should be encouraged to think about their eyes. CCB works with IFA, and the ICU campaign has inserts in major newspapers and on TV, presenting to communities and professional groups to promote education. In the workplace, vision screening is a very important. Workplace wellness programs promote accessibility and flexibility work arrangements so that employees can get to have their eye appointments, and if they have vision loss, to make areas available for them to work that are accessible. Employment benefits, including all treatments and coverages. In conclusion, a life course of healthy vision is possible and within reach. Momentum is growing across the public, non-governmental, and private sector, and within WHO member states to prioritize eye health. Today, let us build on this momentum, embedding eye health into parallel global initiatives and on aging, vision, and work together to ensure a future where healthy vision, and healthy aging are a reality for all. We need to ensure patients are fully informed regarding available treatments and to receive the right treatment at the right time wherever one lives. Thank you for your time.
All right, thank you very much, Louise. So just so people know, there is a Canadian Patient Charter of Vision Care, and it's certainly available if people do a Google search. I know during that particular presentation there was a slight hiccup with the slides, and I do apologise for that, but I can let all those people that are online know that we will make those particular slide deck available to everyone. For the next presentation, Thomas, if you can just indicate next slide so we can make sure that the slide process works properly for us throughout this particular presentation. But Louise, the work that you're doing in your organisation in conjunction with others is really important, and we at the IFA certainly have valued the relationship and partnership that the IFA has established with vision health organisations to bring attention particularly to the needs of older people. So with that, I thank you, Louise, and I know there's some questions that have been coming through. For those of you who are putting messages through the chat function, which I did indicate at the early stage, if you could pose them in the Q&A tab, I can then summarise them at the end of the webinar. So Thomas, I will now hand over to you and thank you for your time.
Great. I think I've unmuted myself. Can everyone hear me okay?
Yes, you're fine.
Great. Whew. Hello, everyone. My name is Thomas Simpson. I am the head of public affairs for Canadian National Institute for the Blind, or the CNIB. I am using a PowerPoint presentation. For those of you who are unable to see, I will be reading out my slides as I continue on in my presentation. So the title slide says CNIB Foundation, Fondation INCA, our French name, Life After Sight Loss, with icons of a glowing sun with a smile, a shoe that is about to start running, a briefcase, a book with both Braille and conventional print, and a smartphone device. Next slide, please. Sight loss in Canada. So I thought I'd start with a pulse check for those on the webinar today who aren't too familiar with sight loss and disability in Canada. In November of 2018, a few months ago, the Canadian government, through Statistics Canada, released their 2017 Canadian Survey on Disability results. What we found with those results was that 37.8% of all Canadians aged 65 and older have at least one disability. The prevalence of disability obviously increases with age, and we found that seniors are almost twice as likely to have a disability as those of the working age. In terms of sight loss, the number of Canadians now with a seeing disability is 1.5 million people. Of Canadians who are 65 and older, that amounts to 9.7% of the total Canadian population. And we can only assume that this number will continue to grow as people stay older throughout their lives. Next slide, please. About CNIB. CNIB is an organization that has been around in Canada for over 100 years. We were founded in 1918 following the Halifax explosion and World War I veterans coming back without any services to vision loss rehabilitation or social and emotional services for those who are new to blindness. The CNIB was founded, and throughout the last 100 so years, we've built a national organization that now does three different things. We are organized into three different groups. The CNIB Foundation, which is our nonprofit organization driven to change what it is to be blind today. We deliver innovative programs and powerful advocacy that empower people impacted by blindness to live their dreams and tear down barriers to inclusion. This is the emotional and social support of our organization. And I'll continue on through the perspective of the CNIB Foundation throughout the rest of my presentation. The other two parts of the CNIB are vision loss rehabilitation services and deafblind community services. Past 10 or 15 years has been a transformational period for CNIB in that we have been working to ensure that post-vision loss rehabilitation services, orientation and mobility, independent living skills are part of the healthcare continuum and no longer a charitable program that our organization offers. Provinces across the country in Canada now pay for specialized vision loss rehabilitation specialists to perform post-vision loss rehabilitation services. These are things like teaching someone new to sight loss about how to use a white cane. This is teaching someone who's new with sight loss about how to independently navigate in their own home, how to cook and clean by being safe and independent. These are the skills such as getting around in your community, from your home to your community bookstore, to your local grocery store, and navigating independently and with safety. Finally, we have our deafblind community services, which are the intervener services we offer to deafblind clients in Ontario. We're looking to maximize our reach across the country. Hopefully we'll have more on that in the coming months ahead. So what is CNIB doing? A few years ago, we asked more than 4,000 Canadians impacted by blindness what they want from life and how CNIB can help. And what they told us was quite simple. They want it all. So as I continue on in my presentation, I'm going to focus on three main aspects that CNIB is doing to help improve the life of people with sight loss, with the perspective, obviously, of aging Canadians. Next slide, please. Boosting participation in the world of work. At CNIB, we're fueling an individual's ambition in championing their equal participation in the world of work. We're enhancing our rehab services to focus on skills needed for job readiness and retention. We're cultivating a new generation of savvy, successful blind entrepreneurs. We're campaigning for more inclusive workplaces and leading the way as Canada's most accessible employer. I'll highlight two programs that we're quite proud of. One is called Come to Work. Essentially, what we're doing is training and helping to provide opportunities for Canadians of all ages with experience in the workforce, whether it's an internship or a returnship, which is an opportunity where someone who has been in the workforce is coming back after having not been able to work, whether that's through their attitudinal barriers that employers have had, or whether that's through changes that they've had with their new sight loss adventure. We have this program, Come to Work, is national in scope. And what we're doing is trying to bring in employers to champion and become inclusive and fully accessible for Canadians with sight loss. Obviously, a lot of this work is meant for people who are still working age, but there is an element of it where we're trying to include the lived experience, professionalism of individuals who might be retired or close to retirement. And that includes our mentorship component. What we're looking for is individuals with sight loss who have worked, who have been successful, either as an entrepreneur, as someone who's had a regular 9-to-5 job. And we're looking to pair them with those individuals, whether they're new to the workforce, whether they've been in the workforce previously and are now new to the world of sight loss, or whether it's someone who has been blind or partially sighted all their life and are trying to come back to work or have never had that opportunity. We're trying to tap into those individuals who have had immense experiences to provide their input, provide their feedback, provide advice to try and ensure that we are fueling this ambition and championing equal participation. What we've seen though is that a lot of individuals who do have sight loss, the full-time employment rate we believe is to be about 28% of Canadians who are blind or partially sighted have a full-time job. What happens often is that because of the barriers that they face, people often become entrepreneurs and start their own businesses. And what we see is that people who are older who are doing this, they've had a few career changes. They've tried to work in mainstream, 9-to-5 jobs, but are just unable to because of different barriers that they experience. Whether that's a barrier with attitude, a barrier with the built environment, or a barrier with communications and information technology. And what we're finding is that the more we offer entrepreneurship programs, the more people who are blind and partially sighted are thriving as an entrepreneur. We've offered a partnership with Ryerson University in Toronto to offer courses for individuals who are blind and partially sighted online to learn about entrepreneurship. We offer a discounted course rate for them, and with successful completion, we refund that money back in hopes that that learning opportunity will then help them propel them in the world of work. Next slide, please. We're hoping to unleash the power of technology. We'll fight to connect people of all ages with cutting-edge technology they need and they want, and help them build the skills to capitalize on its potential. So what are we doing? We're eliminating financial barriers to technology with new financing and grant programs. We're advocating to expand and modernize government funding programs for assistive devices where they exist. And we're developing innovative apps, tools, and training that put the latest tech knowledge at people's fingertips. At CNIB, we say that technology should have the 3 A's. It should be accessible, it should be available, and it should be affordable. We think that Canadians with sight loss, no matter their age, should have access to this immense power that technology holds. As society, or as technology grows, as technology is able to provide more for people, we want to make sure that that technology is accessible as possible so that people with sight loss can also access the latest and newest tools, apps, and training materials. I'll provide one example. You guys can't see me, but I am holding up a smartphone. On our smartphones, we have, I'm using an iPhone, for example. There's an app called Seeing AI. Someone who's able to use Seeing AI, what it does is connect with a volunteer on the other end of the phone who's able to look at what you're looking at. So if you're blind or partially sighted and you need to read a menu, for example, and you're unable to, there's no Braille menu if you're fully blind, for example, and there's no one around who can help you read. What the app will do will connect you with a live agent who will then be able to read the menu for you. This is one such example of an opportunity where we think technology and accessibility can go hand in hand and can really help all Canadians who are blind or partially sighted, specifically those with seniors. But what we see is a lack of training and capacity for people who are a bit older who want to be able to use this power of technology. And that's why we're excited that we've been able to work with the Government of Canada on a project through their Digital Literacy Exchange Program. Through this funding, CNIB will be able to launch a program called Connecting with Technology, which will deliver fundamental digital literacy skills training to participants right now as pilot projects in British Columbia and Atlantic Canada. This initiative will target seniors who are blind or partially sighted and train them in digital literacy, often required of assistive technologies. And we're quite excited for this program. It's slowly getting off the ground. We've finally got the money in place. We've hired the people to help us with doing these trainings. And so far, we've found that this is quite an exciting program where people are very interested to come learn about technology and get it in their hands. I'll provide one other example of how we're trying to unleash the power of technology. In Ontario, a province within Canada, we have a program called the Assistive Devices Program, a cost-sharing program where the province will pay part of the cost of an assistive device. We found that although, in essence, this is a great program, it has not been updated since the early 2000s. So CNIB has been advocating to revision this program, to update it. For those of you who know on the webinar, CCTVs, the large computer screens with a magnifier in it, at one point were a great way for people with low vision to be able to magnify printed materials. Today, lugging around a CCTV is not something that many people want to do. And other technologies, like the power through a smartphone, are able to do that. Yet, the government doesn't see a smartphone as an assistive technology, even though it has so many opportunities for accessibility to enhance the lives of people with sight loss. So CNIB continues to advocate, meeting with legislatures in the Ontario government to try and make this change. Next slide, please. Driving achievement and equality. This is my bread and butter. This is the one that gets me very excited. Will embolden people who are blind or partially sighted to lead independent, active lives and chase their dreams, and will smash the stigma and barriers that stand in their way. How will we do it? We'll transform our communities into beacons of accessibility and inclusion, where people can live, work, and play without barriers. We'll raise our voices relentlessly to challenge that stigma and support equal rights, and we'll advocate. I'll provide a few examples of how we're trying to do this, to try and smash barriers and to create a more equal and equitable life and society for people with sight loss. A few months ago, some of Canadians' top broadcasters, Bell, Chorus, and Rogers, put forward an intervention through Canada's Telecommunications and Broadcasting Commissioner, an independent quasi-judicial body of the federal government, to change conditions of their license from this body so that they would not have to provide specific described video TV shows during primetime television. This is something that the sight loss community had been pushing for many years. And as of September of this year, the Canadian Telecommunications and Broadcasting Corporation, or the CRTC, is mandating that 28 hours of prime time video per week should be described. These broadcasters are citing instances where they're unable to do that, which may be the case. However, we think as an organization that Canadians who are blind or partially sighted should have access to as much hours of described video as possible. In Canada, we're mandated to have 100% of television closed captioned for those who are deaf or hard of hearing. Why can't we make that the same case with described video? And so what we did was launch an advocacy campaign this May to get as many Canadians who are blind or partially sighted, advocates and supporters, to write to the CRTC to say that this should not be allowed, that these companies should be able to work to find a way to ensure that they are meeting the minimum requirement that was put out for them years ago. I'll provide one more example. In Canada, we have been working tirelessly as a disability community over the last 4 years to consult, draft, and create national accessibility legislation. We're lucky to have a minister who is solely responsible for accessibility within the federal government, Carla Qualtrough, a woman who herself is partially sighted. The disability community has been tirelessly consulting with members, advocates, and community members to see what they wanted in this legislation. The first national accessibility legislation in all of Canada ever. This is quite exciting. We can see the finish line. It's almost there. The legislation has gone through our national parliament, through both chambers. People have, disability community advocates and community members have lobbied for inclusion of new and stricter requirements to strengthen the legislation. And we're excited that they were able to do that on 2 separate occasions. We're waiting for a royal assent ceremony, which is a ceremony basically where the law or the draft of the legislation actually becomes the law, so that organizations like our Canadian Human Rights Commission can now go out to federally regulated institutions to find barriers of inclusion for people with disabilities and challenge those barriers and eliminate them. This takes the onus off of individuals with disabilities themselves from going and having to put forward disability-related complaints to organizations like the Human Rights Commission. This small step of allowing the Commission to put forward their own investigations takes a huge burden off of the disability community. This is one such example that we're trying to drive achievement and equality. This is something that both CNIB and CCB have been advocating for strongly over the past few years. It's quite exciting. Next slide, please. But those aren't the only programs that the CNIB Foundation is doing. We offer many programs to help Canadians with sight loss gain the independence and support they need, and I'll just list off a few. We have a Vision Mate program where we pair a sighted volunteer with someone who's blind or partially sighted to help them with everyday activities that they need assistance with. We have peer support groups where people who are blind or partially sighted can come together to talk about their sight loss journeys and to learn from one another. Recently, we launched a guide dog program where we are training dogs to become guide dogs for people who are blind or partially sighted so that they can continue to get around with independence and safety. We have Braille and literacy programs where we teach individuals who are new to sight loss or blindness about how they can read now through Braille. We have a book club where people can access books in alternate formats as they need and discuss it like they would be able to with their sighted peers. And we offer many, many more programs. But I'll leave it there for right now. I'll just like to close by saying that I'd love to take any questions that anyone has about the work that CNIB is doing in Canada to really ensure that people with sight loss are able to lead the lives that they want. Thank you very much.
Thank you very much for that, Thomas. Very interesting and great work that both your organisation and that of Louise's is doing. There has been a number of questions that have come through, so it's stimulated some discussion, which is really great. And one of the comments from Laura was the wording, Thomas, around smash stigma. Liked it very much, working on some research-based theatre or radio theatre to help challenge or smash stigma. So she's interested in creative ways that CNIB is working on this issue of trying to smash the stigma.
Yeah, great question. Thank you so much for that. As an organization, after 100 years, you can go one of two ways. You can continue on with what you're doing and offer the same types of programs and hope that people continue to stay involved, or you can shake things up and become a bolder organization. And that's exactly what we did a few years ago. We changed our branding. We changed the way our organization does the work that it does. And I would say as a result, we're trying to be bolder in what we do. And that's why we're using such, colorful language like smashing stigma. I think the majority of barriers that people who are blind or partially sighted will face, and I'll defer this to Louise as well, with someone with lived experience, but it's attitudes and opinions that people perceive and have that will be the biggest change or biggest barrier to a person with sight loss's life. I mean, you can build a ramp, you can ensure that there are tactile warning indicators on curb ramps on a sidewalk, but if the person who's putting those in, or the politicians who are agreeing to pay for those things, don't understand why you're doing them, and they're never going to be top of mind. That's just in the built environment. Imagine having to only be able to fill out a form with the government at any level to, for example, renew your health card. Something in Canada that is where we have free health coverage for all. Imagine not being able to fill out that form because it's not accessible. If we provide the opportunities where we have, a sight loss lens in our policy making, being able to have maybe an online form instead, where someone who can use their computer then to fill out their form, the same way someone could use a pen and paper. That would create equality in that situation. And so what we're trying to do as an organization is to challenge those attitudes, to advocate to policymakers, to bureaucracies and governments, to society in general, that you need to reshape the way you're thinking, that disability has to be part of that, no matter what you're doing.
Thank you for that, Thomas. Louise, do you have any comments on that particular question, or I can pose another question that has come through?
Well, I believe Thomas has covered a lot of the information there, but one of the big things in barriers is for older persons in particular who have to go to a doctor's, a medical appointment of some sort, and there are all these forms and consents that one has to sign. And of course, they're there in very fine print. These forms, that one of the things that CCB is doing and CNIB as well, is to encourage the medical system to make sure that whatever information that we need to have prior to a treatment is in an available format so that we can read it independently. Because when you go to a doctor's office, particularly if it's a new doctor and they want a history, sometimes the secretary will say, well, I'll read it to you and you can provide the answers. Well, no, that's not what I want to make public to all the people in the waiting room. So it's a very difficult thing. So we're really trying to encourage the medical system to remove this barrier so that when I go in and they give me a form to fill out, I will be able to fill it out in my own time, either right there or send it to me prior to through electronic format so that I can read and do that work. So it's important to remove these barriers, and so many people don't even realize that they are a barrier. So I think that's part of the education too. Thank you, Louise.
One of the questions that have come through was clearly someone that has an eye condition, and it is dry eye, which is way more difficult than just a small irritation. The person's been attending the Herzig Institute in Toronto and spent hundreds of dollars on treatment and medications. And she's asked about what happens to people who aren't mobile to travel, don't complain, can't afford the treatment? Apparently they just suffer. Why is it that we all hear about, why is it that all we hear about dry eye is to buy eye drops? Very little ever promoted about treatment and access to treatment. Any comments from CNIB or CCB on the issue around dry eye?
Oh, Louise will speak. Yes, there's a lot of, I've run across a number of people with dry eye, and it's just beyond just getting tired eyes from working on a computer or something. It's a disease process in itself, and it needs to be medically treated, because if not, vision loss can be the answer that'll happen, I guess, unwillingly, because once you lose the dryness, the moisture in your cornea, you can damage that very much so. And it is one of the IDCs is because of it's through the health boards that are really not taking this as a serious problem. And we need to really advocate more, and we are doing that in some ways, but it's something that's very, very important and needs to be addressed. So pushing forward with
I'm sure that now that the issue has been raised, that both your organisation and CNIB will probably thinking about it a little bit more and raise awareness about the issues associated with that particular condition.
Yes.
So one of the other questions or comments and questions that have come through is that governments could undertake screening of vision from the primary school, which is a practice which is currently undertaken in Mauritius. So a very small island state country where there is screening for all school children throughout their school age years. I suppose my question to that particular questioner was, what happens after you're not in school and your vision loss happens later in life? So what are the screening processes generally? Is there a free, is it for children in school? Do they get free screening here in Canada? What is the general screening process, or is it until such time as people identify that they have an issue with vision that they have to instigate vision screening themselves?
Louise will take a stab at that as well. Vision screening for children is prior to school in many provinces, and each province is different. Sometimes it will go up to the age of 8, but in many cases it's when you first go into school, it's one of the requirements. In other provinces, it's not. So it's the onus is on the parents, but in several provinces, the care is there that they can, parents can take their children to the optometrist and have their eyes checked on a regular basis. And in other places, that stops at, again, age 8 or something to that effect. So it varies across the country. In many countries that I've talked to other people from, it varies there as well. So that it is continually throughout the year in the school, it's a very preliminary screening, but not a full exam. So it's can be costly for parents if they feel their children are not having good results with their eyes. They may go, but if they can't afford it, then the cost is there and they may often be ignored. Yeah. Similar thing happens with seniors. In most of Canada, age 65 plus is covered for eye exams, but in the age group between 40 and 65 quite often is not. And that's an age group when they really should be checked, because it can pick up eye diseases such as AMD or cataracts and glaucoma at an early start when treatment is available, and prevention of blindness is more likely to take place. If you leave until you're 65 and then get an exam, it may already be too late. So it's important to encourage our governments to increase the availability, like so many other exams that are covered under private insurance or provincial insurance, to make sure eyes are checked in the health cares there, which in the long run is a cost-effective way because you don't have to put up with the end results of broken hips and things like that from people who end up falling because they don't see where they're going. So.
Thomas, I'll direct this particular question to you. You know, for many Canadians that are suffering vision loss or vision impairment, one of the issues that often comes up is people have got to make decisions about whether they're going to put some food on the table or pay an electricity bill, as opposed to actually having to meet a cost of glasses, for argument's sake, to improve, or treatments to improve their vision loss. I know I wear glasses. Generally, it's around $600 for a decent pair of glasses for my eye condition. And that is generally quite often out of scope for many people. So what are some of the, do you come across that in your organisation, people actually having to make choices about treatment and glasses as opposed to just managing their vision loss?
Great question. Yeah, I would say so. I mean, the people I generally deal with already have some form of sight loss or blindness. And what we know, as I've said earlier, is that of those people, you know, 28% have a full-time job. Of Canadians who are blind or partially sighted, half of them make under $20,000 a year. So this population of individuals in the country are not high income earners. And a lot of that has to do with barriers to employment.
Yeah.
I think definitely not just access to sight loss treatment or to glasses, but they're making these decisions every day. It's how do I continue to be a member of society, but not being able to pay for, you know, basic internet, assuming of course that you have access to that in an urban setting.
Yeah.
How do I have a smartphone device and be able to connect with my friends, family, and peers if I don't have the money to pay for that smartphone device, whether it's the actual cost of the device or the monthly data plans.
Now, yeah, thank you for that. Now, if I recall, I believe that CNIB has a donations program where people can actually donate their old smartphones, which you refurbish and repurpose for people with vision loss. Is that correct?
Absolutely, yes. It's called Phone It Forward. If anyone is interested on the webinar, you can go Google CNIB Phone It Forward. What we're doing is taking smartphone devices, refurbishing them, and giving them free of cost to a Canadian who's indicated that they would like a smartphone device.
Fantastic.
I'm working with them to train them on how to use that smartphone device with the accessibility technology that is capable for it.
Two final questions before I close the webinar, and I want to thank both of you and the participants for sticking with us for the last hour. So one question is, if you both could make a comment about how do you bring awareness? You know, how can all of us that are attending this webinar bring greater awareness around the issues focused around vision loss? And finally, one for you, Thomas, about the relationship between Lions Club and CNIB as it relates to guide dogs. So, Louise.
Okay, how can we make awareness? That's one of our big programs that we do, is to get out and speak to the community. And we hope that anybody on the webinar today who is a sighted person will go out, and if they have not already had their eyes examined, make sure that they do, and that of their families. Just because nobody in your family wears glasses, it doesn't mean that you may be avoidance of having vision loss, sight loss, or some eye condition. So it's very important, and we try whenever we speak, and we do go to schools, service groups, and many different places, employment centers, workplaces, and do these presentations so that the people in those areas can realize that, you know, you need help. to make sure that we don't have sight loss as
Well,
one of our jobs.
there's definitely a role for all of us to play, no doubt, in raising awareness.
Yes.
So, Thomas, you know, the relationship Lions Clubs and CNIB around guide dogs?
Yeah, absolutely. And I'll be honest that I don't work too much with our guide dog program. So what I'm going to be saying isn't quite as nuanced as I would hope. There are a few organizations across the country that do offer guide and service animals. I think what we saw as an organization that there is an increased need for people with blindness or partially sighted have specialized trained guide dogs, that the need is not being met. So after some careful consideration, we decided to get into the guide dog game, and we've been working as best as possible with you know, the Lions Club and other organizations to ensure that we're working together and not hurting any other organization's chances of getting their dogs out into the hands of people who need them best.
Well,
For more information, you can go, as I said, onto our cnib.ca, I think /guide dog, and there's more information there.
Well, with that, I'm going to say thank you to the both of you. I will finish by saying that falls from people suffering from vision loss because they're not getting access to treatment or not getting treatment is a significant issue, particularly for older people. Poor vision is one of the major causes of falls for the elderly. So for all of you that are on the call today, if you know older people, your grandparents, parents, please encourage those people to have their eyes tested regularly. And if you know people with diabetes, certainly that should be an annual checkup that they're having for eye testing. I thank you both for the presentations. I will let you know that the IFA conference in Niagara Falls in 2020 will have a significant component around vision loss as it impacts function and capability. So please consider going to the IFA conference website and thinking about joining us in Niagara Falls in November 2020. And I thank all of you for joining today and look forward to hearing from you in the future. So thank you.
Thank you.